We're glad to have with us Mr. Yves Sassenrath, the UNFPA representative in Egypt. Thank you very much, sir, for joining us at the podcast, the podcast.
Thank you very much, Ashraf, for having me. It's a pleasure.
The UNFPA as well have been strongly partnering with the Ministry of Health and Population since the start of the global PHTC. And in New Year's Start, you told me that you have been assisting. This is the second time that you assist us. Would you tell us how far you see how it's evolving in relating to the content and the subject that have been tackled?
Thank you very much. This is the second time. I arrived in Egypt in August last year, so a little bit over 14 months now that I'm here. And this is a pleasure for me to be now on the second Congress for Population Health and Human Development. And we can see a real iterative process of excellence that is progressing and also a vision that is evolving. So I think last year was a very important Congress because it was just after Dr. Khaled Hafar was also has become the Deputy Prime Minister for Human Development, besides his role as the Minister of Health and Population. So that was a very big moment, and we see a marked progress in the narrative and also in the evolution of how Egypt is embracing the concept of human development, where population and health is at the center. So we saw yesterday, for instance, a wonderful panel in front of the Prime Minister's Excellency Mabuli, and a number of very important ministers around the Deputy Prime Minister, Dr. Khaled, and showing that Egypt is making progress in integrating the concept of human development into its policy making. I think that is the legacy that Dr. Khaled is building, that he is pushing and coordinating across all the ministries as a Deputy Prime Minister to integrate human development as a concept, where then population and the Population Accelerated Plan and the Population Strategy of Egypt that is also enshrined in MOHP's mandate is really the operational arm on how now to concretely implement the human development agenda.
The UNFPA have been heavily partnering with the Ministry of Health and Population in several projects for many years. Let's start with the women health and the fertility rates. What are the tools and measures that you as UNFPA are using to assess this partnership and how far this cooperation has been moved?
Thank you. So UNFPA has been working in Egypt for over 50 years. We are the UN's agency, as we say, the population agency. So we are looking at the whole of society approach. Now, in doing that, we are referring back to the International Conference of Population Development that was celebrated in 1994 in Egypt. So Egypt brought the concept of no one left behind, of investing in people, and looking at people beyond their statistical number and linking people's choices with regards to their families and their reproductive lives, the spacing, as a core element for prosperous societies. So Egypt is a pioneer in this, and we are now 30 years after Cairo 1994. So that's where UNFPA gets its mandate from. And how are we embracing this mandate? We're focusing on women's health. Women's health with the vision of President Sisi of Bidaya, a life course approach from birth through menstruation, through childbearing age, to menopause and beyond. Because we need to have a holistic approach. We have an aging population. We have still in Egypt 60% are below 30 years of age. And we are moving into a dimension of the 21st century where we are confronted with artificial intelligence, jobs and skills, and the job market will change. So how are we approaching this? Where does life come from? The woman giving birth. So we need to ensure that women are healthy, not only healthy physically, but also healthy mentally. Then we ask the question, what is preventing women from being healthy? Certainly, early child marriage, child pregnancies, social practices like female genital mutilation, and others are obstacles for women and girls to be fully participating in Egypt's prosperity. Only 15% of the labor force are women. There's a huge potential there. But only a healthy population, healthy women, will give birth to healthy babies. That's why it's really important the support that we give to the Ministry of Health and Population in the area of maternal health, to make sure that less women are dying while giving birth, tackling the maternal mortality issue. Very closely linked to this is the neonatal death rate. So healthy mothers are healthy babies, nutrition, so that we are supporting with other agencies like UNICEF that the women that give birth are healthy women. Then the children will be healthy. So the food systems and stunting, for instance, is a very important element that is very high on the agenda of Dr. Khaled and the team. Because stunting is the result of early childbirth, adolescent pregnancies, or malnutrition. Only like that can you prepare the conditions for investment in human capital to actually flourish. So the role that the UNFPA is playing is to accompany the Ministry of Health and Population in the area of women's health, maternal health, reproductive health throughout the life course, also at the older age. Then also giving those families access to the choices for planning their spacing, having access to family planning methods. And then the last bit is the area of mental health, mental resilience, violence against women and girls, interpartner violence. Women are often subject to violence because of social norms and dynamics. So that's the mental health part. This is really the journey. It's important also to mention that we're supporting the ministry and the Egyptian Drug Agency in the area of pharmaceuticals as they link to women's health, especially family planning.
One of the toughest acts of policies is to change habits. So related to the nutritional habits and the big problems of stunting, malnutrition, especially for youth. What are the policy recommendations or the projects that UNFPA has been involved to change the nutritional habits of the Egyptians and enhance the micronutrients in the daily Egyptians?
So I think we need to also, first of all, we need to recognize the enormous progress that Egypt has made with regards to its total fertility rate and the vision by the president through the Bidaya initiative that is being put into place and activated by Dr. Khaled and the Ministry of Health and Population, but coordinating as a deputy prime minister, is basically changing the vision from population control into investing in human capital, human development capital. That is at the core of Egypt's success by actually reducing the fertility rate from 2.75 in 4 years, from 21 to 24 to 2.4. So we are at the right track. The objective by 2030 is around 2.1. So that's just above what we call replacement rate. That is important to answer your question, because what did Egypt do to arrive at that so fast? Other countries don't reach it so fast because fertility and reproductive behavior of human beings is very tied to their social norms and how they believe their emotional, physical, and also spiritual life is organized, right? So you have practices like polygamy, you have larger families, etc., that are all part of the social and cultural fabric. Also, habits, food habits, what you eat, when you eat, etc., all part of a certain social norm basis. So what we have done is we are not just through the Ministry of Health and Population, but also through the Ministry of Youth and Sports. We're working across all the 27 governorates with youth, where the youth centers, but also the primary health care facilities that are managed by the Ministry of Health are talking together. That from an early age through when couples are coming together to get married. That's a program that the Ministry of Social Solidarity is running by Maweda. This is all interlinked so that the families and the young couples are aware of how important nutrition is. But then there's the linkages. A crucial linkage is, what are we giving our kids to eat in school meals? Because they will spend most of their time, as soon as they go into entry to primary school, to secondary school, they will eat a lot in school canteens. Where a lot of kids eat today is at the corner kiosk. At the corner kiosk, you don't get quality food. That is an important element in the mosaic in making sure that if we invest and we care about nutrition and healthy meals at the school age, we are investing in healthy brains and a healthy and health society. So this is how we have been working with health professionals in terms of training. We are now embarking on a big vision by Dr. Khaled and the team, especially Dr. Abla Al-Alfi, in revigorating midwifery in Egypt. And the midwifery of the 21st century it's a health professional that will also tackle something that is extremely important and on the agenda of the country. Egypt is unfortunately the world champion in C-sections. Egypt has the highest level of cesarean sections in the world. Now, this is not good news. This is not good news because a C-section, we know, isn't necessarily the best method for the child's health and the mother's health. So we need to work, and we're working with the medical professionals, with the industry, with the universities, to change a narrative that is not so much medical, but more social. The midwife will play a very important role as a partner of the OB-GYNs to work together for a more holistic approach to women's health. So these are, for instance, initiatives that we're working currently with the Egyptian government through the Ministry of Health and Population.
You have pointed that lots of programs that are implemented and have been implemented. And nowadays, there is this comparison across low-middle income countries on projects that could be replicated in one country or another. What are the successful models that you see and could be an example of best practice that the UN could share this model in regions?
So we had two important events this year. We had an event that was led by Egypt through the Ministry of Health and Population in the spring of this year at the Commission for Population and Development at the United Nations in New York, where Egypt was leading a session that was called Healthy People, Strong Economies. Egypt convened the president of the BRICS, the president of the G20, South Africa, Brazil, and Egypt, around the table to show how the approach through Bidaya, the Bidaya initiative, but also investment in human capital, the Golden 1,000 Days, and the population strategy with its acceleration plan have really made an impact on controlling in a way and balancing, more than controlling, the fertility rate, so that we have the right fertility rate for Egypt, that it is ready to embrace its role as a prosperous country. So that's a big event that we had where Egypt was showing global leadership, and countries, especially in Africa, big countries like South Africa, Nigeria, have approached Egypt to learn from Egypt's approach on how Egypt was able to do this through human capital investment.